Hi, and welcome to the Sheroes Collective. This is episode 6, and with me is yet another amazing Shero, one hailing from, currently, at least I should be saying, KZN, so KwaZulu Natal province of South Africa. And with me is Haseena Majid. She is a devoted mom and daughter, and so many other titles. Like Haseena, your bio, I looked at it and I love you, but like really, I'm going to give you my version of Haseena. So Haseena Majid is an optometrist, right? I'm right. It's an optometrist and based in Pietermaritzburg, has her own practice. She's also a Atlantic Fellow or Global Atlantic Fellow, linked to Tekano Health Equity South Africa. And she also supports people learning within her space at the local universities or even within her own practice. So there we go. She actually has her own practice as well. So Haseena is deeply, deeply passionate about eye health, and I want her to really speak about that. But the reason for having her on this for this particular session is because I was keen on understanding what exactly it is that kind of pushed you from a clinical space into the advocacy journey that you're on. So both Haseena and I are on the same advocacy or fellowship group, which is Tekano, which I've mentioned before. But also, other than that, I can't leave out the fact that you have a master's and you're currently busy with your PhD. So I want to honor that because that's big, right? So welcome, Haseena. How are you doing?
Thank you. Thank you very much. That basically sums me up totally and really well. I suppose the last part that's not there is how much I love food. And that would be all that's left. Thank you so much for this opportunity, and I do appreciate the magnitude of this platform, given that there's so many dynamic women coming about and still to come in coming weeks and months. I know that the platform that we occupy is a game changer because for the longest time, women don't have the space to be able to simply speak without judgment, without fear, and without being boastful about what it is that we do. Like you mentioned, I am an optometrist in the private sector space. And over the last year, I transitioned to public health. And that transition was very slow. It was also very unknown. I didn't know it was happening, but it was actually happening. In about 2009, 2010, roundabout there, I took on a job with an organization that was trying to integrate optometrists into the public sector. So optometry forever has been positioned in the private sector. And then there was a few organizations in Limpopo and KZN trying to bring optometrists into the public space to make it more accessible. And that's where I started my journey, heavily pregnant, in a new province with nobody that I knew. And I had to deliver eye health services in public facilities. And when you're young and you're naive, and I think when you are uneducated in terms of what health equity is, and when you don't have the understanding, about where the challenges are, what the indictment is on the health system, in terms of what they are giving and how they're making it possible. I existed in that space in complete oblivion. And a highlight of my time was that every Friday I had to go to a clinic in Pietermaritzburg, and my testing space was in a maternity ward with 2 beds on either side. I had my little chart on one wall, my patient sat against the other wall, but there were 2 mothers dilated and contracting on either side. And I was testing men and women and total strangers in their private moment.
Yeah.
A
But this is
nurse would walk.
reality. Like the
This is
system, this is what
reality.
it looks like. So yeah, it's really great that you bring these things up because we often have conversations around what you're passionate about in terms of eye health. And we're always having conversations around how these intersectionalities and how, it's almost like you're fighting for space. If you think I work within the HIV space, we get a lot of airtime, right? And you are busy fighting along that line. So was your experience in the public sector seeing these injustices, seeing the limited resources, because I can't also just say injustices. Yes, it's it's inequity, it's injustice, but it's also people trying to just do what they can within the system without that lens from the outside going, do you realize what you're doing? Yeah. So is that what assisted you?
So I think the fact that I was highly pregnant at that time, and funny enough, I went into labor in that clinic on a Friday. After I processed the fact that I was in labor at work, in a labor ward, testing people's eyes, and then I got transferred. This was my first baby, to a private hospital. Literally, I drove myself down the road to a private hospital, got myself into a private bed, waited the night in sheer comfort, with privacy. And then I looked at the how naive and vulnerable giving birth, especially natural birth, makes a mother and a woman. You become so vulnerable. You are so exposed on so many levels, right? And that was a hard hitting moment in my life. Like, everything I've done suddenly contextualized, and I was like, seriously, this is not on.
Yeah. It's
How
interesting
was
how your
I
own
even
experience, right?
standing in that room between two contracting mothers, not cared that what I'm doing is such an ethical violation? Let's start there. And then I realized that there were so many layers and complexities in terms of public eye health service delivery, what it looks like, who represents this, where the voices are. And I didn't have labels for it at that time, the way I'm saying it now, complexities, layers, and so on. I just knew that whatever it was too much to be able to unpack in a day. And I then jumped out of that space and I went fully into private practice, because I looked at the salary that optometrists were earning at that time. It was completely unsustainable to raise a family. It was even unsustainable to survive, leave a family. For a single person, it was not sustainable. And I moved into private practice. My struggle started there. When I was growing up, I watched my grandparents use a government health facility, and not really my grandparents. My granny was always well for the longest time. It was my grandfather.
Yeah.
And I would accompany him to Helen Joseph Hospital, watch him sit in the queue. My granny would pack us a basket of lunch, and watch that. And he was a very patient man. And even when people would complain about how bad the health service was at that time, my granddad always had a positive thing to say.
Yeah.
He never had a bad experience. He never encountered a bad nurse. He never had a bad doctor.
Yeah.
And later in my life, I realized it was because he brought that much of patience with him every time.
He
And
came
when he
prepared
did
with a
that,
basket, so they knew they were going
yes,
to sit for the day. Yeah.
he knew, and he didn't have that rush inside of him. And when he eventually was seen, he exchanged pleasantries, and people were not like frustrated to see him because he wasn't imposing, like making it difficult for them. So it was like a give and take.
Yeah.
And I remember as a young child saying, one day when I get big, I'm going to do something that nobody else's grandfather sits for the whole day. I just remember saying that. I didn't know what I wanted to do.
Yeah.
And so when I got into private practice, optometry, can be very opulent. It can be very expensive. It can be very brand conscious. I was very conscious and intentional that the practice that I set up was supposed to be a private sector experience for a public sector patient.
Fantastic. So I remember one of the very first conversations we had, you were telling, I remember you mentioned something about how you educate your clients, even to be saying to them, if you save, I don't want to say some ridiculous amount of money per month or per week. It was a per week example you made. I don't even know if you said R1 or R2 or something, which I mean, in the context of anyone listening globally, you can go and look what that is, but in your own context. But it is the most minimal amount, and you were actually working out for them what that would mean in 52 weeks and what that would mean if it was longer, and you would be giving them this service at a particular cost. And I think that isn't something that anyone in the private sector, I mean, I also wear spectacles, and it's not it's not what you say. Like you say, walk in and these brands, these colors, that is being sold to you. And obviously you thinking about it from an aesthetic point of view, right? And not that actually it's essential, I need this, I need to be able to read. So just how do you go about making sure that your services are equitable? Because like you just said now, you've made sure that you're giving people who can't necessarily pay what someone in the private sector is paying for the service that you're having. How do you make sure that that happens without obviously denying yourself the ability to survive? How do you do that?
So what we do is at the beginning of every year, our labs and suppliers give us their pricing, okay? And obviously with inflation, every year it goes up. What I was doing for the longest time was I was trying to keep the eye exam as low as possible so that people could at least get the clinical service. Sometimes getting the clinical service doesn't always translate into you having to purchase a pair of spectacles. You might have the clinical service. Like yesterday, I had a woman who is clinically obese, but now with mobility impairment. So her eye exam translated into a direct referral to manage the obesity before she will get a pair of spectacles. You get people with uncorrected hypertension, autoimmune disease. So my main aim was to say, maybe you won't come here and get glasses, but when you do come, I'm going to tell you that you are potentially diabetic, hypertensive, and it's the first door towards healthcare. Referral is the first step in the healthcare system. It's a form of service delivery, so it's linkage to care. So that was my approach. And in terms of keeping it affordable, what I do is as an advocacy in my adverts, where you'll find that people would advertise buy one, get one free, add a free sun changeable tint. Yes, I do that because I cater for a market that would benefit from it. But a lot of times on my advert, I say that your basic pair of spectacles can cost you 72 cents a day. And that's to let people know that you can actually touch this. It's not far away from you. So if you read 72 cents a day, you'll be like, oh, I buy data for like 100 rand, and you quickly do the math in your head. So I keep the prices low intentionally, and I don't keep it low through grants and fundings and subsidies. I keep it low by cutting my profit. So I don't do the markups that you would find everywhere else. And I'm actually surrounded by so many independent optometrists who operate on the same model. They understand the need.
That's amazing.
And we're really not in it for that, that high markup. We'd rather see quantity and catch up that way than to see a few people at a high amount of money.
Yeah.
So basically we shifted away from the retail model and we went more into a clinical model. And that model has been serving me for about 15 years now.
Wow.
Touch wood. We do have more difficult challenges to overcome as compared to those who would be in the retail space. It's very much harder to catch up the amounts of money that you need to pay when you're waiting for people to come through the door. And obviously, people are not able to make payments upfront.
Yeah.
They would need to pay it in 3 months or 4 months, sometimes longer. So the money comes in very slowly. But I can definitely say with a lot of conviction that maybe our interests are in the right place and our intention is in a good place. And so far, touch wood, everything has just went through the way it was supposed to. And I think it's a very fulfilling experience just watching how nothing goes wrong, even though you have no control over the process.
Yeah, no, I hear you. The other thing I wanted to touch on, so the one part that I didn't introduce about you is that you are the founding director of USAWA, Healing and Learning, right? And so we connect on that level as well. But through USAWA, you are now busy with a national eye health project. And can you just tell us a little bit about that? What is it that you are intending to do with that?
Okay, so USAWA is a Swahili word which means equity. It was actually born out of the fellowship at Tekano, where I realized that in order to move ahead, you're going to have to find pathways to sustain yourself, to be able to do the work without shortchanging yourself and shortchanging the work that is underway. So what I did was we realized that there were different streams of work that a few fellows were working on, and we wanted to bring it under one umbrella. And each one of us wanted to bring the area of passion that we were working in and leading in, and eye health was mine. But how it came about was in 2018, I was one of the founding members of a public-private health forum in Pietermaritzburg. And just through informal, random conversations and pulling people together into one room, we ran a Mandela Day camp for cataract surgery that the private sector stepped up to with so much of freedom and will. And I thought to myself, oh my God, if I could be part of this, and it was just so, like, off the cuff, if I sit down and concentrate, I'm sure I can do something better. So I used that as the springboard for my PhD and for the National Eye Health Project, because what we did was we took the learning of that one experience and we started to unpack it and go all the way down, using that but why kind of system, until we realize the complexity at a community level and at a policy level and all the missing pieces in between. And so USAWA now, through the National Eye Health Advocacy Project and the team of people there and supported by Tekano, we are now looking to see how we can at least initiate 2 steps at a policy level and at a community health level, and try and see how we can create some common thread from the top to the bottom, bringing into consideration your public-private partnerships and so on. We're still in its early days and we're still busy mapping out what the roadmap looks like. But overall, it has been very progressive. We presented at 2 conferences. We have some national engagements and it's looking promising.
Yeah, that's fantastic. So, I mean, we're coming to the end of our discussion, but I just wanted to highlight things that came out of this for me, is that very much you're about collaboration and about being very intentional about seeking people, stakeholders to engage with, to find different ways of kind of spreading the message around eye health, knowing full well that, and what I liked about what you said is, yes, you are rendering an eye health service, but you are looking at the health and wellness of someone like holistically and looking at that referral pathway. So I think to any clinician out there, whatever, or anyone practicing in the healthcare space, if you have your own practice or you're busy supporting others, think about just how you can holistically care for someone, and then work with other partners in order to make your the passion and the advocacy that you are trying to champion for, how you actually make that work. So those are some of the things that stood out for me about this. But I mean, you're not this one-track pony is what I'm wanting to push out, because I know you shared with me around your passions around obviously employment, gender equity, gender-based violence, making sure that they are messaging around all of that and not only. So do watch the space around the National Eye Health Project. There will be things on social media. It's in its early phases, as Haseena said, but it is coming, and be part of it. Is there any social media platforms people can follow you on, or that you wanted to highlight as a last word?
So I think LinkedIn is the better space to find the updates on. It's where I try to keep everyone connected. We still have to set up our Instagram and Facebook pages, but I do try and keep as much information available on LinkedIn as possible. And I'm always available on WhatsApp and email. And so anyone can just connect with me. I'm there all the time.
Yeah, exactly. Okay, thank you so much for your time, Haseena, and I hope anyone listening could hear exactly why you are on this podcast. Again, a Shero within your own space. Keep on doing the great work. And to anyone listening, and to everyone listening, I should say, not anyone, everyone listening, please do like, subscribe, and share the Sheroes Collective podcast so that we can grow this platform and make sure that all these amazing Sheroes are heard and are connected to anyone out there with opportunities for engagement and collaboration. Thank you.
Thank you.